The spread of highly contagious COVID-19 variants in neighboring Venezuela, Brazil, Trinidad and Tobago and other parts of the world poses a serious threat to Guyana, a country which lacks the laboratory capacity to detect these variants. Even as daily infections and deaths continue to rise steeply during what is referred to as a third COVID-19 wave amidst an aggressive vaccination campaign, a local microbiologist believes that there's more that can be done at the airports to monitor incoming passengers for possible symptoms of the variants. In an interview with Nightly News, Paul Chetty expressed that a simple modification to the current entry protocols could provide a better understanding of the status of the persons that are allowed in the country.
Quarantine period, I think that's something that we need to have instituted here. Not just, okay, if you get a negative result on the very next day that you've been in country. It has to be that you stay quarantined for 7 days and then you do an additional test.
He further explained that this strategy is necessary and has been effective in other countries such as Singapore.
What we've seen is that, especially for the India variant, and this recently came out in the UK, a person can be negative for 14 days and then develop symptoms, get a positive test, but they had 14 days to spread the virus. And that is especially concerning if they were not in home isolation or institutional isolation. So our isolation strategy needs to be improved.
Testing for new COVID-19 variants cannot be done in Guyana at the moment. However, samples can either be sent to the Caribbean Public Health Agency in Trinidad and Tobago or the Icahn School of Medicine in New York, according to the Minister of Health, Dr. Frank Anthony. Since January, health authorities have not indicated that samples were sent abroad for testing. Presently, incoming passengers must provide a copy of their negative PCR COVID-19 test result to Port Health officials upon arrival. If the test results are more than 72 hours of the time of departure from the country of origin for Guyana, the traveler must be retested in Guyana at their own expense. Those who are retested and are negative are allowed to depart the airport without the need to be isolated, while those who are positive can be isolated at home or in hospital. Temika Rodney reporting for the HGP Nightly News.